A very good evening to all the respected doctors present here. I, Dr. Snehal from the USV medical team, welcome you all for yet another interesting session in the CME India live series, where we bring to you another interesting topic, the role of digital tech solutions, gadgets and AI in medical education for the UG, PG or paramedics, the pros and cons. Without much ado, I would now like to introduce to you our esteemed speaker for the evening, Dr. N.K. Singh, sir. Sir is a director at Diabetes and Heart Center Research at Dhanbad. He is also the editor for CME India, who has been helping us to put together these fantastic sessions. And I hand over to you, sir, to introduce our speakers for the evening. Over to you, Dr. Singh, sir.
Yeah, thank you, Dr. Snehal. Good evening to all our viewers. This is another exciting episode of the CME India webinar. And I think we are on the second part of AI discussion today. I think many of you must have heard Dr. S.B. Kulkarni, I think 2 months back. Today the topic is a bit different. The role of digital technology solutions, gadgets, and the artificial intelligence in medical education for UG, PG, and paramedics, pros and cons. In the morning, I gave a just slogan that you hate this topic or you love this topic, but you must know this topic. So this is so important. CV PPT of Dr. Kulkarni. Yeah, next. So I think Dr. Kulkarni is well known in this field. He is the MD General Medicine and Associate Professor of Medicine, MGM Institute of Healthcare, Navi Mumbai, and Certified Trainer, NDEP, FGSI, Fellow of Genetic Society of India. So many lectures, founder member of API, Konkan chapter, conducted over 250 works nationwide and over more than 40 research papers. So he's a great speaker, and I think today in India and even abroad, he's I think making a good place in the field of the AI and medicine. I also welcome today Dr. Rajesh Kesri. To my surprise, he is also a pioneer in the AI field, and I'm really thankful to him that in the very short notice he will agree to moderate today's session. He is the director and consultant diabetologist, Total Care Control Diabetes Center, certified diabetes speaker and trainer, and even for the ADA and postgraduate program in diabetology from the Johns Hopkins School of Medicine, a SCOPE certified bariatric physician and fellow of Diabetes India, and so many fellowships, so many papers, and so many awards. So welcome, Dr. Rajesh Kesri and all our viewers. So I think I think he will come now. So I think straightforward, I request Dr. Kulkarni to start his presentation. Dr. Kulkarni.
Yes, thank you, sir. Thank you for a brisk and crisp introduction. I will start sharing my presentation, and by the time we go to the first slide, are my slides visible?
Oh, but please start the slide mode. Slides, yeah, now it is okay.
Okay, it's okay, no?
Yeah, okay. Yeah. Okay.
So friends, today we are going to talk about AI in medical education. These are not futuristic dreams, but these are today's realities. We welcome you to the transformative world of AI-powered educational tools. A dream project of Dr. N.K. Singh and CME India, where we are going to see a big change in the future way we practice. Friends, I got a lot of disclosures. First of all, I must thank to CME India, and I have used lot of inputs from my colleagues, Amit Kumar De, Bharat Sabu, Avnish, Alok, Om Lakhani, Suresh Shinde, so many to name. Dr. Janani Muralidharan, she presented this topic in the last API. And what this topic has told me, it given a big lesson of life, that learning never ends. And of course, it is a vital component of medical education of today. And whether it is undergraduate, postgraduate, paramedicals, we are to discuss everything together. And I cannot forget role of Dr. Rajesh Kesari. Rajesh has been interacting with me for last almost 72 hours. We are exchanging slides and mails. So Rajesh, what is in your mind when we think about AI and medical education?
So,
Yes, please.
thank you so much, sir. First of all, my apologies for joining late. That is because of some technical glitches that I couldn't start. Actually, I should have been starting this. So, first of all, I'm very thankful to Dr. N.K. Singh, sir, for having me here, for making me a part of this webinar. I have a passion for technology, I have a passion for programming, I have a passion for artificial intelligence, and I've been working since almost 2 decades on integrating this in the medical care at our center, especially with diabetes, how to manage our patients with diabetes in a better way using technology. And now, when we saw this topic of utilizing technology and improvement of medical education, we see vast field. We see an opening of a very vast field because technology can complement the learning process. It can improve the learning process, and it is something that we did not have access to in our learning days. In ways it is unfortunate, in ways it is fortunate that we could actually have the real exposure to the cadavers, to the, let's say, the frog muscles that we use to study physiology on. Things have changed a lot. Things have changed a lot in these past 2 or 3 decades since we passed out, and now the coming younger generation of students is facing. So, sir, I would request you, Kulkarni sir, because you are regularly in touch with students, our coming young generation. What do you see? What has changed, and what is the role of new digital technology and artificial intelligence in the current system of medical education?
You have made me to unfold a story of 50 years. This was in 1974, how I used to look it when I was a student. Now I am a teacher and I am presenting you with something which has happened for last over 50 years. Friends, AI, I will not expand as artificial intelligence. It is assisted, augmentative intelligence for an intelligent doctor. But unfortunately, either it is not understood or it is ill interpreted. Please remember, AI is maths, not magic, and many aspects of AI are not understood by anybody of us. There are maybe few people who will like to know what is the basis of AI. The basis is how you can multiply like a human intelligence, that is the base. But if you see in our day-to-day practice, what are the things we are having? Let us start something from very simple thing like a rule-based logic or risk score. We are calculating body mass index. We are calculating ASCVD calculators for the risk of atherosclerotic heart disease. Then we are using a lot of predictive models. There are a lot of targeted neural networks. And here comes the big player of AI today, that is generative AI using large language models. ChatGPT, November 2022. No software, no program in this world has been successful as much as ChatGPT. So if we consider all these things, on one side, we have got a deterministic AI, which is more targeted. And on the other side, it is a probabilistic AI, which is more generative. Let us not go into the technical jargon and see some of the things. What are the benefits? Number one, accessibility. AI has made medical education more accessible. Resources, learning, age, distance, all barriers lost. Personalized learning, I'm going to touch it into detail, but it can tailor educational content to meet the individual needs of medical student. It adapts your way to learning and your pace and style. I may be a slow learner. My teacher also has to teach me slow. My style may be a bit different. You will adapt to it slowly. Simulation and virtual patients, a big subject. Safe environment for students to practice clinical skills and decision making without the risk of exposure to real patients or cadavers. And don't forget, the currency of today is data. Data analysis, vast amount of educational data, very fast to identify trends, improve the teaching methods and student performance. These all the things go hand in hand. There are a lot of other benefits. There are chatbots, which are intelligent training system. Virtual patients we talked of. A lot of gamification can help you. Quizzing. You must have heard of Kahoot or Slido. It really sees your pre-test knowledge, what you have understood, and gives you score on the post-test knowledge. It is an adaptive learning assessment. Optical mark recognition, I need not tell you when the neat things are going on. There are a lot of automatic essay or thesis scoring methods available. Talk about these different kind of realities, whether it is virtual, augmented, mixed or immersive in a later time. But most important, diagnostic, analytic, interpretative, prescription writing, and emergency response skills assessments are very much possible with the help of AI to everybody at the flick of your button. Why I am talking to you about all these things? Look at 2010 and 22. See the number of applications of AI. Maximum benefit, radiology, then pathology, then ophthalmology. And there is something called as a enabled medical device can be considered as a part of the treatment armamentarium of the patient. The articles which are increasing, like huge number of articles going on. There is an increasing focus of research on AI and machine learning. And you can imagine the amount of money which is going to flow. Now, Rajesh, you had this question in your mind, that what are the applications of technology in AI and medical education from cadaver to VR, from patient to simulated patient. Let us go one by one. Let us go by our medical school track. What are the recent researches and developments? The students are generally receptive of use of AI in the education, recognizing its potential to enhance learning and clinical practice. It can provide real-time feedback, accurate evaluation, and most important, monitors the teaching quality. It is important both for educators and students. And the integration of AI in medical education is expected to grow with the focus of developing AI systems that are more user-friendly, effective for teaching various aspects of clinical medicine, right from etiology, pathology to prevention of it. This was a study, and this is the latest publication from BMJ, that the study was, can AI improve medicine's uncomfortable relationship with mathematics? And look at the proportion of correct answers and responders' confidence in the answer with and without AI assistance. Without AI assistance, it was 17%. With AI assistance, 83%. The respondent confidence median, only 2. Here it is 4. So all the p values are positive. It fits into your evidence-based medicine, saying that AI can be of use. Friends, we have come all the way, very long, right from the Gurukul system to the virtual reality dissection table to the webinar, what we are going to see through. And please remember, any new thing which comes in the reality or in the world, it gets a resistance. When the printing came, people thought that this type of Gurukul thing is going to go into doldrums. But it never happened. On the contrary, it improved with the help of books. So from Gurukul to the smelly anatomy theaters to Zoom meetings, we are a long time. Dr. Singh may recall, we have used things like these projectors and these slide projectors and the rotator slides, and now we are at the LCD projector. Teaching we have been doing conventionally to the modern way. And don't ask me from which school or college is this. This is from MIT. You can have a LCD also, but there are boards the 16 votes like this which go and up and down. So you have to have a combination of modern as well as day practice. Those who are teachers in the group, classroom scenarios are universal everywhere. We need to keep them engaged. How to keep them engaged? It is an example I give, first MBBS, e-cadaver or a AI-enabled e-cadaver. Physical cadaver labs are expensive to run. There are biohazards, costly to create. It's difficult to see anatomy like lymph node, certain blood vessels or pancreas gets autolyzed in a physical cadaver. And that's why the students use virtual reality headsets which projects to 3D models of either the male or female body. And these tools provide students to ability to mimic surgical procedures. So these are the something which they are wearing on their head. The same thing is pursued by, and the teacher can ask a function or origin or insertion as what we normally face in the first MBBS. This can combine even 3 subjects of first MBBS. Anatomy, physiology, biochemistry, all the things can come together. So this is a prepared virtual dissection table called as Anatomage. There are alternatives also. We can see one by one. So here comes your virtual reality. What it does, it offers immersive and interactive experience, hands-on practice, realistic scenario, repeatable learning. You cannot dissect a body 10 times. You can dissect it only once. Safe learning environment we talked about, and it has got enhanced environment. So these are VR simulators. Where the simulators are used? Surgical training platforms like Osso VR and Touch Surgery. We are going to share this presentation with all of you. And in that, you can just go to this website and find it out. Anatomy education table, we saw anatomy table or 3D organon. SimX and Oxford Medical Simulation. They create realistic patients. And there is a, in the emergency response, suppose if you are managing a case of anaphylaxis, the virtual reality medical training tells you that the first and foremost drug of choice is oxygen and adrenaline. Unless you do that, you will not go to the next step. So these simulators are practical. There are so many other aspects. Radiology and imaging training. This is called as the Radical and EcoPixel. Procedure simulation platform like Vitrify and medical realities. And there is a lot of interprofessional education. A physician can teach a dentist, can teach a physiotherapist, can teach a pathologist. So this interprofessionality is possible with the help of AI without having a significant knowledge to the other side of the world. Let's take example of physiology. What happens? We have got a centralized healthcare service like that. We have got a library. We are patients. We book the reading. But the AI-based wearable sensors will give a lot of information about one person's monitoring and other things with a cloud base. Means there is no question of storage. Your mobile will not say that your storage is getting over. So these are the possibilities which are not only for the recommendations and patient feedback, but for monitoring also. These are the wearable health monitors. I can monitor a whole cricket team of your body weight, right from plantar pressure to your EEG, intraocular pressure or blood glucose. So what? I take an example of flexible sensor. This is a plantar pressure. It is attached to the body. There are physiological signals, goes to hospital database for analysis. It goes with body conditions or therapeutic methods and gives a feedback. So what it will tell that this person has got either a flat foot or a diabetic foot. It will create a 3D design for the person which will go to the orthotic and prosthetic department of your college, and the person will be given a different sole just by analyzing the plantar pressure. This is the real gains of technology. Forensic medicine, pathology, your toxicology. There is something called as a virtual autopsy or a liquid autopsy. You can analyze the body content, blood and other things without cutting the body, and you can come down to a conclusion. You can analyze the body, bone age. All these things are possible with AI. And this is AI-enabled pathology and microbiology. This is a big way in which the things are coming, and we'll be happy to see the lens of a microscope being converted into a 84 inches television. And what is the name? HistoWiz. Is from bed to research bench. It automates histology for researchers. It lot of features it gives from histology to the advanced things. But I got a request to all the clinicians. If you want to get a good advantage, give a detailed history, examination finding, investigation, previous summary reports for comparison. I think Dr. Singh and Dr. Rajesh will agree to me. Please act like prompts and avoid inconclusive reports, or please correlate clinically. If you give a good information, because AI is nothing but a data science. If you have got good data, you are going to get a good results. This is how, suppose a small section and the big section. There you can share it with everybody, but this is something which I can show you in 3 slides. What were path chat. This slide is there on the screen, and here you are going to give an answer question. Describe what you see in these images, which organ I am looking at. It gives you answer that this is the 3 images. You are looking at the tongue. The first image shows normal squamous mucosa, which are the typical lining of the oral cavity, including the tongue. Second image shows skeletal muscle fibers, which is a normal component. And the third image shows a squamous cell carcinoma. It has identified. It is called as a pattern recognition. If there are 1,000 cats and only 1 tiger, you will search for 1,000 things. But AI-based structure can pick up the pathology as early and within few milliseconds. You ask a third question, what is the degree of tumor differentiation? And it is giving an answer. The tumor differentiation is determined by resemblance of the tumor cells to the normal cells from which they are originated. In this case, the squamous cell carcinoma is moderately differentiated, which means that the tumor cells still retain some characteristic of normal. I can go on telling about patch chat for another 10-15 slides, but let us switch off from here to something different. Now, if you want to do a genetic research, if you have got a genetist, you have got a program called as a SnapGene. It goes to the application of viewing the annotating the DNA sequences. It helps you in cloning procedures, visualizes your work, automatically records your workflow, and there are more than 2,700 plasmid files. So the molecular level research can be done very well. This is the complicated but a real accurate diagram of a human genome, and microbiology cultures with the help of our knowledge going from macroscopic to microscopic to genomics. It can classify, quantify, detect and segment the microorganisms very early as compared to the conventional methods. That's another boring subject in our second MBBS is pharmacology. This is a reverse of Moore's law. Moore's law is what? If the car and the computer would have grown by the same speed, we would have completed the circle around Earth in 10 seconds. So the technology is fast going, but take an example of this organization, the number of drugs are going down. Why they are going down? If you have got 100 investment, you get successful in 5.3. The development ceases in 94.7 people. It is the place where AI will come, and it will help for drug design, literature revision and analysis, identifying the drug targets. It will help you for pharmacological screening, helping for clinical trials, and most important, knowledge communication and transfer, explore the market, and write scientific reports and publications. All these things are possible, friends, with the help of AI, which is helping the pharmacological industry. Take, for example, cardiology. The cardiological practices are going to change like anything. We have got multi-omic integration of drug designing, digital twins, and AI-based clinical trials, and you are going to get drugs which are going to have almost nil side effects. But what is the basis of this? These are the wearable technologies for scalable access. This is a multimodal integration of your data, and you are diagnosing the things in a proper way. This is from Canadian Journal of Cardiology, the latest reference, how it can interpret the ECG and echo. So, Rajesh, what is your say on the further part of this? Rajesh. Because we discussed.
Yes, sir. I think I'm very thankful to you. You've covered a huge topic. You've covered the role of AI in many different aspects of medicine, many very important aspects of medicine, in pharmacology, in histopathology, in medicine itself, in cardiology. And obviously, I think there is no field of medicine, no specialty of medicine which has not been touched by AI in one way or other. So obviously, it is a huge sphere which cannot be touched upon in such a short period that we have in this webinar. So before we go further, any comments from you, Dr. Singh, sir?
I think we are slowly giving a glimpse of how the AI is developing from our days of when there was nothing, even the computer was not available, to how the things came. And slowly in the 2024, I find that for any search or any question or any queries, I think the fastest way to assess it to the AI. So even for as far as the medical education is concerned, although there are lots of concern whether applying the AI could hamper the real intellect of a person or a student, or whether we can develop the real diagnostic skills, human diagnostic skills. So whether there are some of the challenges, whether the AI will surpass to all these things. So these things are very important. That how the AI can backfire to the medical education. So I think this juncture also we will discuss this. Otherwise,
yes, I think we'll come to this in the conclusion, the later part of the webinar.
So far, it is quite interesting and quite fantastic that AI has penetrated into the medical education.
I think we should underline here what Kulkarni sir started with in this section of his talk was that together with technology, digital technology, the advent of artificial intelligence, when they have come together, this hybrid technology has benefited our students and medical education a lot. And there are some very stark examples. One is virtual reality that he talked about, the education of anatomy, surgical procedures, where the patient actually is not harmed. I recollect our emergency learning days when we used to learn lumbar puncture and other procedures on live patients, and I'm sure all of us must have in their memories some mishappenings or something. So these are avoided to a very great extent using the digital technologies, the virtual reality, and artificial intelligence, that the students have a very good hands-on experience, at least on the models and using the virtual reality. And the art of communication with the patients, even though there are some, as Dr. Singh was telling, some reservations are there, but the art of communication, history taking, meeting the patient. So there are now simulators which simulate all this, as sir was telling. So all this is definitely great. There are a lot of things happening, and I'm sure that the AI would also be helpful in assessing the progress of our students, as you started very rightly that not all students are similar learners, so even the teachers have to keep pace with the students. And now, how to monitor how a student is progressing, what is the progress, where he is lacking, AI can be very useful in this as well. So, sir, the next question which I would request you to talk about is the role of AI in improving the quality of medical education and improving the students' feedback and their assessment, because this is just as important as we are seeing the problems that we have that are happening with NEET and other exams. Now, if AI was to be integrated more in the learning and the assessment process, would that lead to any better results? Over to you, Kulkarni sir.
Yes, thank you. Rajesh, this is a very, very, very pertinent question what you asked, because whenever we go, people are going to ask only one question: is going to replace the teachers? Is it going to replace the doctors? So, sir, very strong answer is no. What I feel about my teacher and what my students feel about me is totally a humane way. And we are teaching them how to examine the patient, how to evaluate the patient, how to analyze the patient. The theory part will be updated by AI, but our basic clinical skills have to be there, and they will be really helpful by using digital tech and AI. Example I can give you: automatic grading. It can grade written exam, quizzes, and assessments, even like multiple choice questions, short answers, and essays. There has to be a performance analytics, and there will be a personalized feedback. The student may fail into something like a biochemistry where there is a lot of mathematics involved, but he will be very good in drawings and very good in help explaining the logistic way in which the things are happening in psychiatry. So you pick up the weakest link into his personality and strengthen it. It examines both the sides. In the simulation performance assessment and the VR and other simulation based training, you can assess students' performance. What it that means? Actions, whether the actions are correct. If you are making him to make a suture, whether the action is correct. Decision on which part he is taking the suture, and outcome, how it thinks looks after he has taken suture. And it gives a detailed feedback on procedural skill, decision-making process, and overall competence in simulated clinical scenarios. Please remember, here no patient is hurt. NLP, natural language processing, it assesses students' written and spoken response. This tool, it evaluates the clarity, accuracy, and depth of their explanation, or even interviewing. NLP tools used to analyze discussion and interactions, providing insights into students' communication skill and the clinical reasoning. How a student approaches to a patient. If he says, "Good afternoon, sir, my name is Sriram Kulkarni. I am a third-year student, and I would like to know more about your edema on the legs, and I will like to examine your abdomen." So all the tone of my talk, everything, how I speak to the patient, it is analyzed. And if I found a bit more arrogant, then the teacher may tell me to change the tone of my talk. So the examiner, examinee, and where VR gadgets are going to the things of future. Here the evaluator is there. He is present in a holographic format. This person is doing a gastroscopy. He has just put the laryngoscope here and going to put the gastroscope. Every procedure will be analyzed properly. There are many things to add. Predictive analytics. AI can predict students' future performance based on current and past data. So, if you identify students who are at the risk of failing behind, the educators can intervene early for the additional support, resources, or even emotional encouragement. It is a good way to develop it continuously. Dr. Singh may ask me that now why you are approaching 70 and why you are interested in subjects like artificial intelligence. But friends, it gives me a very good opportunity to stay young. According to me, this is my anti-aging medicine and increases my serum levels of enthusiasm. So this continuous development for any doctor is very important. There are automated surveys and feedback collects, which may be for the courses, instructors, and learning experiences. This helps educators to understand students' perspective, normally in India we don't encourage the questions. But if you must have seen in the conferences like American College of Physicians, the lecture is of 40 minutes and the question answers go for 20 minutes. It makes necessary adjustment to improve the quality of education, both for the giver as well as for the person who is giving. So now we have got lot many mid-career subjects and options. What are the mid-career options and how a artificial intelligence can help? This is a GMAI model. What it does, it has got flexible interaction with data, images from the electronic health records. It can be paired with languages, either form of text or speech. This is called as a multimodal AI. Then this model needs to access various sources of medical knowledge to carry out medical reasoning tasks, unlocking the wealth of capabilities that can be used for downstream applications. My patient of cirrhosis can have 10 different etiologies, but how a alcoholic differs, how a hemochromatosis differs, how a Budd-Chiari syndrome differs. That is all possible with the help of this technique. And this is a leveraging formal medical education to the reason of previously unseen tasks. I might not have seen a patient of hemochromatosis, but my other colleagues, if you have seen, then their knowledge can be accumulated. And it builds the foundation for many apps of clinical disciplines. I will suggest you to go to Google Play Store and download an app on ABG by my very good friend, Dr. Satish Devpujari from Nagpur. What he had done, he has tried to understand from basics. So you have got text, audio, images, EHR, signals, different kind of omics, you get a graph. What are the medical knowledge domains we have got? You have got literature, publications, clinical notes, and knowledge graphs. So if you put the blood gas value there, it gives you a diagnosis. And there are like this was just one example, but there are a lot many things where you have got a lot of questions, answers, exchanges, and you will have a multimodal input and output. So these are the foundation images of all of us to understand the situations. This is a very good article to have an overview. That is the GMAS, versatile and self-explanatory bedside decision support. And this is the Nature DOI, which you can download, and you will really like that. The augmented procedure, a rare outliner finding is explained with step-by-step reasoning by leveraging medical domain knowledge. There is something called as a grounded radiology reports, which clickable links for visualizing is finding. So this is a decision support at the point of care. Suppose if the patient is in ICU and you have got all the things, sugar difference, insulin required, or how to correct hyperkalemia, you will get an answer at a click. You got a patient who is complaining of hip pain, the X-ray has been done, it picks up the narrow joint space and osteophytes compatible with osteoarthritis with the hip. This is a rare diagnosis. Endoscopy has been done and this picture is sent to AI and the question is asked, explain the object appearing on the left side of the screen. This is a stomach, this is a esophagus or stomach, and this is something different. The answer is object resembles to artery wall situated close proximity to the duodenum. Given the size and location, it is most likely to be the aortoduodenal fistula. Very rare disease, very rare diagnosis, but AI has helped you for that. Rajesh,
Yes.
anything else?
Yes, sir. So, one quick question. You see, research is an integral part of medical education. So, all our students do need to present their thesis, do research, and we need to inculcate good research practices in our students. Now we are seeing that AI is being used more and more in research in every field of research for accessing data, articles, and in fact, some people are using it to do the writing work also. So, sir, please throw some light on using AI as an assistant in research.
Yes.
Yeah, Dr. Kulkarni, I will just interrupt here. So really, this is a very, very big, good question. And most of our physicians are eager to know it. We are many times, many articles, we are taking help of AI. So what is the status? Whether if suppose I write a paper and I send to a journal, whether they want to know that I have taken the assistance of AI or not. So what is the status?
Yes. Thank you, sir. You actually stolen my words. The AI in research can work for five main things: automated literature search, text mining, statistical analysis, image analysis, content generation, and most important, plagiarism detection. At the end of this discussion, I will tell you whether you can quote AI as an author or not. But please always mention what AI tool you have used in the whole process. It recognizes pattern. It can identify patterns of data that may not be apparent to human researchers, leading to new hypotheses and research diagnosis. And for me, what is most important is predictive analytics. It can predict outcomes based on existing data. Rajesh is good in Excel. My friend Alok is very good in Excel. And I think we are not using 1 lakh part of Excel. If you have got existing data, there are suggesting potential areas of research and clinical trials, which will be really, really very a good opportunity for all of us. Now, this is one of my very favorite site, writingmate.ai. So this is called as a chat labs. And there are 30 AI models in one place. Why I'm not going to go into the details that what is GPT-4o, what is Claude 3, what is Gemini Pro, and what is Llama. These are all the AI models with large language processing. You have to go to the website and you have to ask. And what do you ask? Ask like a prompt. Ask a very good question, it will give you a very good answer. But for all the students and physicians, my request for you is you first prepare a skeleton of your project and then only you go and talk to AI. Don't ask AI to do everything for you, because I have got fantastic softwares which can detect that how much of AI you are using. So Chat Labs is one application where are all the best AI models. Of course, you have to pay for something. It can generate images with DAL E3 and stable diffusion. And these are the three main big subjects: ChatGPT, Claude, Gemini, and Llama 3, which we can do. So everything has got a price tag. There is nothing like a free lunch, and we should not expect free lunch. So download, pay some money. GPT assistants have the medical student helper also allows you to upload medical text and PDFs to create a personalized knowledge base. For any LLM plus, you have the flexibility. And this, if you purchase in a group, it will be a much easier thing. There is one more program called as Illicit. What do you do with Illicit? You create an account, tell about yourself. There are two types of plans, basic and plus. It searches for paper, it extracts data from papers, it finds concepts across papers. I was talking to Dr. Rajesh. BMI not a good indicator of obesity in India. So what is the alternative? Height to neck ratio, height to waist ratio. So I upload my own paper on height to neck ratio. I get the results to review later. And then if you have got good amount of money, then you be a part of this and you will get lot of summarization of 8 papers at a time, and it will chat with you full text of papers. You can summarize the papers with AI. So what I will suggest, you don't ask how to do it, but you take a paper. For example, this is a very simple thing. Those people who, there are a lot of practitioners, there are a lot of physicians in this country who don't have access to echo. So I have got a poor man's echo that is called as a P-terminal force as a prognostic indicator post AMI, which correlates to the left end and left ventricular pressure. So this has analyzed. It is going to ask me that you do have another step. So if you want to really know what is the prognosis, look carefully at V1, the negative part of P-wave. The first screen will me show the top 2 papers. It will give me the summary also. So what summary is there? This is a simple ECG variable related to left ventricular failure, can easily put into clinical use to differentiate MI patients who are at a greater risk of dying during the chronic phase. Suppose if I don't want summary, I want everything. I want the main findings, methodology, intervention, outcome. Also, I want to know the negative aspect of it, limitations. It is possible with this app. You can get some more references and apps, but you can get some add-on information also. So, what is the value of serial P-wave changes indicating left heart failure in MI? Or you ask some odd question that does it predict paroxysmal atrial fibrillation in acute ischemic stroke? Definitely something very important. Does it indicate atrial fibrillation recurrence post-pulmonary vein isolation? Or whether interatrial block and P-terminal force is a reflection of mitral stenosis severity on echocardiography. You can easily do a paper on subject like this. A very simple finding one wave of ECG giving such a plethora of information. So there are many other things. There are few considerations. In curriculum integration, incorporation of existing curriculum requires careful planning and resources. We have to understand the student perception. Understanding wave of AI is crucial in acceptance and effective use in education. There are few questions regarding ethical and privacy. The laws are being built up, but definitely skill development is accelerated with the help of AI, and they can have different type of careers. People are going to ask, is it going to kill creativity? Is it going to make me an AI-enabled dumb? No. There cannot be a new qualification like AI-enabled dumb medical practitioner or a medical professional. We all are intelligent. We have got our original intelligence, and all these techniques they are going to help us for a long time. So Rajesh,
Yes, sir. Yes, sir.
please.
So
I
this
think
is also a very important part of going ahead in the discussion. So what I want our viewers to understand is that how we can actually, just as you said, that it is not necessary that we would all become dumb professionals because the AI has already come in. It is there to stay. So how we can leverage it to our maximum advantage, and how our coming generations can leverage it to their maximum advantage. So the next question comes, that can AI or these technologies, can they be useful in planning the future career of our, let's say, upcoming young doctor?
Yes, I pick up the same D word. Instead of the 4-letter word, I will tell you that AI can make you to become a distinguished medical student or healthcare professional. It is easily possible if you apply it in a very, very positive way. And what is the first step? I need to assess my aptitude. AI analyzes data from academic performances, test scores, and everything. it will suggest your specialization that aligns with the student's skills and interest. It analyzes my personality and interest. There are a lot of surveys. The interest, career goals, data from these surveys can be analyzed to match students with medical specializations that align their personal and professional preferences. This is the predictive analysis. The likelihood of success of various specialties based on the historical data. It compares the students' profiles and gives insights into which the specialization student is likely to excel in. There is something called as a career path simulation. You can put forward yourself. What will be my career after 5 years, after 10 years, 15 years by your previous data. There are some AI system virtual stimulations of different medical careers to experience what is likely to work in different specialties. They understand their day-to-day responsibilities and most important challenges, aiding in their informed decision making. If somebody wants to become an obstetrician, expert obstetrician, he must be ready to accept the night calls. If he says that he doesn't want night calls after the age of 30, that obstetrician career is switched off for him.
So now I think is going to be the most interesting discussion of this evening. We've talked a lot about AI, about digital technologies. We've talked that it is like, a new Amrit Kal that we are living in. It looks like that. When you hear everything about AI, it looks like that this is a different era of technology, and maybe we are lucky to be in this. But I remember my school days, and when I needed a picture of an aeroplane or the Swiss Alps, I went to the Swiss embassy, got a magazine from there, cut it and pasted it in the project that I did. But now things have become very easy. You can write to in the chat box of DAL-E, create a picture of me on the Swiss Alps, and you have your own picture on the Swiss Alps. So things have become very easy. So is it all that good? Surely it must be having some drawbacks, some side effects. What should we be wary of so that not to fall in the trap, not to become the dumb doctor, but remain the distinguished doctor? So your views on these, sir?
Thank you. Thank you, Rajesh. And Dr. Singh will agree with me that since we are very basic and we are clinical practitioners, AI is going to definitely to help us. Now let us go back. You compare the conventional versus the AI methods. What does a student do? He reads something, he reads it again, he tries to remember. Ratification is a typical Indian terminology, everybody understands. Then you try to recall, you reach at the time of need, whether it is going to give a good result or not, you don't know, and you don't remember anything after that. This is a conventional method of doing. But with AI methods, you've got a wide choice of teachers. It can be individualized. You can review the things at your own convenience, own speed. It assessment at all the stages. It can be done in a funny or a quizzy way. Slido, Kahoot, these are the examples. Learn one, do one, teach one, and it is a non-fatigable model. That is the first positive point which I want to tell you. It holds great promise for revolutionizing medical education by enhancing the learning experience, personalized education, improving clinical science. It is important to address the challenges associated with implementation. It complements traditional teaching methods, prepares medical students for the future. Whether, like what Dr. Singh has said in the last message, whether accept it or not, it is the future of health education with the help of AI. But there are few points. One of the most important thing is you lose a human touch. If you lose a human touch, then the confidence between the patient-doctor relationship is hampered. The second point is about data privacy and data secrecy. If the data, suppose if somebody is HIV positive And if we are including him into any of the drug trials, and after the drug trial his identity is disclosed, that becomes a problem. So AI has to be used in a very, very responsible way. It is a two-way sword. It cuts from both the sides. You must know which side you are using and for what you are using the AI. I always give a very simple example. AI and digital technology is like either swimming, cycling, horse riding. Everybody of us, as a child, we have gone through this. You have to go into the water, your head and your hair should be wet. You should be off balance from cycle. You must, have your decorated kneecaps. And if you want to ride a horse, the horse should throw you out once. But once you adopt it, once you use it, and once you start practicing it, there is a fantastic pleasure out of it. We may get AI-enabled hospitals with a change logo like this, but friends, don't forget that there is always a gray matter and the stethoscope in between the 2 ears, which has been used by the brain, the hand which touches the patient, the face which talks to concern with concern to the patient and relatives. You take your hand of your patient in your hand and the patient will feel comfortable. These are the things which cannot be passed on with artificial intelligence. So we have to be smart clinicians who are going to be enabled with AI. So
Thank you.
I thank Dr. Rajesh Kesri and Dr. N.K. Singh for helping me in this whole presentation, and whatever the topics are there or whatever the questions are there, we can answer them as a group. That will be much better. So Dr. Singh, I have answered some of your
Yeah, Dr. Khetri, yeah, first let us finish there are 2 or 3 questions.
Yes,
One is, can I opt out of AI-driven care if I choose to, and what are the alternatives?
Okay. See, everybody wants to use AI for research and publications, but AI cannot be second author. There are controversies. There is a guild of medical journals editors. What they mean, they want you to mention the source from which, or the type of, suppose if you are used illicit to prepare the project, then you should mention that I have taken help of illicit. If I have taken calculations from calculate by QX, I have to tell that I have used calculate by QX. If I have taken something from AnyGem AI, I have to mention it. And the plagiarism can be easily picked up, so there is no alternative. You can use it, but use it very, very intelligently. That is the most important. Rajesh, I think you will agree to that.
yes, I completely
Just
agree
don't
with
copy
you.
paste. That is what
Yes.
people do, and I will not suggest you to do a copy paste.
And there are some journals which explicitly mentioned that they do not accept papers which have been generated by the AI. AI is very good for doing the literature search, as you said about the systematic literature review. But I would like to warn all our listeners that you should not take the AI generated messages or outcomes as they are. So whatever literature you find on the AI, you should go to the source of the literature, the source of the article, check the source of the article, read it there, and accept it only from there, because AI makes mistakes and it makes tremendous mistakes as of now. So it cannot be taken just for granted. So this was one thing which I wanted to touch upon was bias. There's a question related to
Yes,
this.
one thing.
That can the hospital systems drive efficiencies and success with AI? Yes, they can drive efficiencies and they can drive success with AIs. The root cause of that actually is that AI is working on pattern. The usual computer systems that we are used to work, they do certain specific tasks. Like they have been shown a road on which they have to travel. Now AI is not like that. AI can choose their own path. They can learn that when they went on that road, it was a bad experience. So AI is intelligent, it learns from its mistake, but for it to learn, it has to be given the data. Now it learns from the data which it has received, it has seen. So that data set has to be right, that set has to be good. If it gets a biased data set, then the output from that is also biased. Similarly, it goes for the student learning, for the student assessment, and for medical applications like giving outputs in clinics or wards and ICUs. So the input data is very important. Dr. Kulkarni had mentioned this in his talk, that we should have a very good set of good input data to get the right results out of that. So this bias would be there if you don't have a very good data. One thing which I am personally worried about AI is that I feel that it stifles the creativity. Now I'm seeing that it is stifling creativity in children. Now they don't write themselves, they have to write a message, they speak, they don't even type the message, they speak to chat GPT, it gives them a good message. Most of the websites that you see, the ads that you see, everything that you see today is actually written, is AI generated. It is not natural, most of the text. So this is the stifling of creativity, and I'm sure that's going to happen in the medical field also. That empathy that all doctors used to have, it may just go away because students will get used to listening to AI generated text, reading AI generated text, and listening to AI generated talks. So, Dr. N.K. Singh sir, what is your opinion? Because this is something in general, it does not pertain to only medical education or medical science.
Yeah, Dr. Rajesh, I think this you have raised a very pertinent question and issue. This is a real danger of the AI, but I really like Dr. Kulkarni told in the last that remember that in between your patient or in the hospital there will be a stethoscope. So that is a very important message he has given. So that empathy will remain, and without that, the whole medical profession will not survive. And we are humans, not robots. So that is a very important that we have to take somewhere some a step where how much it can penetrate into our lifestyle in our medical education and other parts. Rest, cannot be the 100% with the AI everything, but only thing that I fear that there are lots of now the I think AI driven sites. You just give the symptoms, they give the differentials, even they sometimes give your the diagnosis after that treatment also. So Dr. Kulkarni, you tell ki how can we rely on those websites which
No.
are some doctor driven or whatever they may. I think this is a very important. The public is asking
Yes.
what to do for that.
No. There is a question also. Will AI replace human healthcare providers? 100% not possible. It will ease the process. It will reduce the workload. And AI, even if you ask ChatGPT that I'm suffering from cold and so things, can you prescribe me a drug? The first sentence is that I am not a medical doctor. I'm not a medical professional and not authorized to prescribe any medicine. It will tell you, some simple things like paracetamol and everything, which a small child knows. The real worst problem of AI, like what said by Rajesh about bias, is second is what are the hallucinations. AI can hallucinate. If you ask him them any question of February 2023, it will not answer because the data is only up to December 20, before that, December 2022. And that hallucination is very difficult to predict. Anything related to life-saving skills or the drugs, you have to always dependent upon the authentic sources. What you can do is you can feed a paper that what is the drug of choice in leptospirosis, whether azithromycin, doxycycline, or combination of amikacin and amoxicillin. It will analyze the paper and then it will give you a result. But just by asking ChatGPT or Gemini, you cannot prescribe a drug to the patient. It is very risky. The second question, which was asked about the literature and the publication, even if you are mentioning the literature search has been done by AI, using AI and apps like illicit and writing tools like that. You have to make a mention that the references were done with AI, but they have been physically checked by one of the authors who is in the group. That has to be mentioned, otherwise the article will not be accepted. And there are going to be a lot of changes into the editorial policies of the literature which is going to be published, especially say after now we are really seeing a very upsurge of AI in medical publications. But I think by 2025 January, the journals may change their rules like very stringent and very, very practical, which is going to promote only the real research, not the AI-enabled research. Thank you.
Yes, sir.
I think there is one more question. Rajesh, one more question. How AI is contributing to research and the development of new medical technologies? I think we have already discussed it now.
Yes.
Yes,
Already we
I
have
think Dr.
discussed.
Kulkarni had mentioned very well in one of his slides.
Yeah.
One of important things is drug research. So what AI is doing is that because of the complex computational models which have been enabled because of the AI, so the interaction of drug in our body with our complex system is already assessed in the computer in an artificial environment. So that enables lot of it gives lot of more avenues in drug research and getting to the final molecule much earlier than it used to take 20 to 30 years. The other thing is tailor-made drugs. Now we all know that so many drugs are actually tailor-made to the molecules, to the receptors. So this advanced computing has actually enabled these things, and the drug research has increased to a very in a very fast pace. I think to us as a doctors, this is very heartening, and we are seeing in past, I would say less than 5 years, so many different molecules, the double agonist, the triple agonist. How come they have developed so fast? And I'm sure that technology, 3D modeling, and AI is much to the help in these developments.
Best example is the
I
COVID
think we have
vaccine.
reached the, yeah.
Yeah, COVID vaccine.
Dr. Kulkarni, I think now we are at the end of this webinar. So
Yeah.
I will take a final message from both of you. So please go ahead, Dr. Kulkarni.
Okay, sir, I will request all the attendees and all the medical professionals to get adopted to the simple techniques of artificial intelligence, but use them responsibly. That responsible word is very important, and we should not do any harm to others, and we should see the positive outcomes of it, which will be, weighed properly. There is a concept called as a Nirakshir Vivek Buddhi. You must know the difference between what is milk and what is water. So take the best out of it and utilize it here for patients. It will definitely help you. It will change your life. It will change your practice. That's from my side. Thank you.
Definitely, sir.
Yeah, great. Dr. Rajesh.
Sir, thank you so much. So what I'd like to say is, I would just like to take this further, that artificial intelligence, it is a very good assistant to us. It can help us in doing many things which used to take a lot of time. It can ease our daily course, a lot of processing work, and we should use it as an assistant. We should remember that we are human beings, we have emotions, and others expect that responsibility, those emotions, that empathy, and that deep understanding which we have and which machines are very unlikely to have, even if they become very intelligent. So I think this is one part of our nature that we should never forget, because our words, our expressions have a healing power which none of the machines have. So with this, over to you, sir. Dr. Desai.
Thank you,
I
Rajesh.
think,
Sir,
I think this was a great discussion, great presentation. And in nutshell, you have Dr. Kulkarni given a very, very good message to all of other medical people. I think lots of questions come to us that how AI is helping and should we go for that or not. Many people are not adopting it. For them the message is that we must adopt it, we must modify it according to your need, and we also take the last message that we are dealing with the human mind, human empathy, and for that there should be some barrier somewhere where you should stop. Accordingly, Dr. Rajesh, we have given a very, very important inputs. I think we are going to make a story for the website also from all this discussion and the PPT. And think you have given a really very, very great time, great inputs, illuminating inputs, I will say, and that will definitely help to our CME India audience that how to deal with the profession using the AI. With that, I also thank our audience and USB team, Dr. Snehal and others for providing this platform. So over to Dr. Snehal. So you conclude it.
Dr. Singh, thank
Yeah,
you.
yeah, yeah.
I just want to add something. I must thank USV for this wonderful opportunity and you to speak up the whole concept of using in all our day-to-day practice. There is a wonderful article written by Dr. Rajesh. It's a 8 pages article, and that article will definitely circulate to all our participants and at all our views. And this will be even Snail, you can do it with the help of USV, and it can
Definitely.
go to 5,000-6,000 physicians which you are taking care. That is
Yeah,
Definitely.
Dr. Kulkarni, we are going to make a whole story out of that. I have got the article, Dr. with Rajesh Khetri and with your contribution. And already the US of today CME India group had around 7,000 people who are reaching every day with our 7 groups. And more one the new group is being created now. And with that, and the USB people have lots of I think reach, even more than 70-80,000 people they are sending our inputs. So Snehal,
I would
finally over
just
to you.
like to mention one thing here, sir. I don't
Yeah,
think any AI can match your hard work and the amount
yeah,
of
Rohit.
efforts that you put. I'm always amazed how you can manage so many groups, still be speaking at so many conferences, and almost traveling every week to 2 or 3 places. So hats off to you. You're much ahead of any
Thank
other
you.
AI, any AI
No,
at
no,
all.
thank you, thank you. So that is the thing how you manage your time. Time management is the key. Yeah, Snehal.
Yes, sir. Thank you so much, Dr. Kulkarni, sir. I must say, after the first session which we conducted on AI, we received tremendous appreciation from the audiences. And yet again, here we have three of the stalwarts in the field coming together to put this fantastic session again today. So I believe this is going to be a legacy to continue with in the future. So thank you very much, Dr. Kulkarni, sir, for such a fantastic oration. And thank you very much, Dr. Kesari sir. Time and again, you were participating throughout the program to add fantastic value that you bring to the table. So thank you very much, Dr. Kesari sir. And last but not the least, Dr. N.K. Singh sir, who has been putting together these fantastic programs. And we have successfully managed to keep our audiences engaged and happy. So thank you once again, Dr. Kulkarni sir, Kesari sir, and N.K. Singh sir for giving us this opportunity. And we are really very happy and proud to host you in the near future with more such interesting initiatives. So thank you once again, and we really look forward to meeting you soon. Thank you
Sure.
very much.
Thank
Please
you.
share it with as many
Thank you.
people as possible. That is a
Yeah.
good way of
Definitely, sir. Definitely. So we
that.
will be sharing the article with as many doctors as possible with our outreach program through the digital initiatives as well. That is definitely a promise from our end.
Thank you.
Thank you so much.
Thank you, sir.
Thank you.
Thank you. Good night.
Thank you.
Good
Good
night.
night.
Thank you.
Good night.
Good
Thank
night.
you.